Dr. David Blyweiss back again. I've been asked to discuss briefly a Reader's Digest version of adrenal gland fatigue. And this is something that we're seeing more and more of as society's stressors become more and more. We tend to forget that in the last 10,000 years, physically, the human being has not changed so much. It is the culture and society around us that changes. We no longer eat a nutrient-dense organic diet every day. We don't go to bed when the sun goes down and wake up when the sun gets up. We are harried and hassled by traffic. We're eating food that doesn't give us the nutrients we need. We are inundated with noises and sounds around us that are just unremitting, and we are getting more stressed and more stressed. Well, thank goodness we have a gland that tries to help us protect ourselves from the stress, and that gland is the adrenal gland. Two little cone-shaped glands that sit on top of your kidneys that put out almost 50 hormones in the body: cortisol, adrenaline, DHEA, progesterone, testosterone, and very critically, they're the glands that help regulate our stress levels, our ability to metabolize carbohydrate, fat, protein for energy. And when these glands get stressed, they specifically will put out these hormones that will protect us. As we get a little bit more stressed and they begin to fail, we get symptoms that, although we are taught in medical school about Addison's disease when the glands fail, or Cushing's disease when you have too much of cortisol and other hormones, the idea of a suboptimal adrenal gland early fatigue hasn't really been put forward, hasn't been put forth. And what you find is that when you wake up in the morning, you may wake up at 6, you may wake up at 7, but you're not really there until 9:30 or 10 o'clock in the morning. You don't really get going until 10 o'clock in the morning. Between 2 and 4, almost every afternoon, if there's a bed available, you'll take a nap. You really only wake up after 6 o'clock at night, and you go well till 8:30 or 9, and then you can go to sleep. If you pass that, you probably can go till 11, 12, or 1, and then you crash. You may have some brain fog. You are basically chronically fatigued. And the problem is that most doctors don't recognize this. They think that you are stressed out, here's an anxiety tablet, or here's an antidepressant, when what you really need is to sleep a little bit more and perhaps a little bit better, eat a little bit better, make sure that you're feeding your adrenal glands what they need. Basically, the vitamins they need are B5, B6, vitamin C. You want to make sure you check the DHEA level, because they do need that if you want to rest them while you're feeding them. And critically, what we find are people who have the munchies for crispy potato chips, or they just need to add salt to their food. These people are also lightly adrenal gland fatigued, and we make sure that they get their sea salt in them. Classically, you will find it takes 6 months, 9 months to get your adrenal gland back where it's supposed to be. And what I like people to do is, even if you can't meditate or you don't have time for yoga, there's something called mindful breathing that is actually a cheat from that we took from Buddhist monks. And basically what it is the only proven non-pharmacological method to decrease stress cortisol levels in the body. And all it is mindful breathing, where you inhale for 4 through your nose, hold it for a count of 5, and exhale through pursed lips for a count of 6. You can do this initially when the cortisol is surging in the morning. So before you get out of bed, give yourself 5 minutes of, you don't have to close your eyes, but 5 minutes of If you do that for 5 minutes, you are going to decrease your stress cortisol levels, probably decrease your pressure if it's a little bit elevated, and give yourself a chance to have a better start of the day. If you can do that in the afternoon about 4 o'clock, you'll save your adrenal glands a little bit more.